a warrant. Missouri Senator Claire McCaskill says her mother, Betty, was addicted to prescription drugs near the end of her life.
She made that admission today in Kansas City during a talk on health care. KMBC 9's Michael Mahoney was there.
Getting the right people in there so they
Her mother, Betty, died in 2012. At a meeting at St. Luke's today, McCaskill brought her up during a meeting about the dangers of prescription addiction. McCaskill says late in life, her mother was addicted to prescriptions.
And frankly, some of the times she was in the most pain was when she was actually going through withdrawals. And so she wanted the drugs because she was coming down off of the drugs.
She was at St. Luke's to talk about the rising cost of emergency room health care. Many drug overdoses of all sorts land there. She says that many with insurance see their premiums rise to cover the uninsured who go to the emergency rooms because they have no other choice. And to cover that cost, hospitals charge more to their insurance companies.
And then the insurance company hangs up the phone and they call the small business owner and they say, guess what? Your insurance rates are going up 10% next year. So that's what people I don't think they get, the connection.
Democratic senator believes that some of the costs could be contained if Missouri expanded Medicaid. She told the panel that Missouri's failure to do that means the state is losing out on over $17 billion over 10 years.
In my opinion, that was one of the largest hidden tax increases this state has ever seen.
As McCaskill talks about the rising cost of health care, the rising cost of insurance, and shares a family story about the problem of opiates. In Kansas City, Michael Mahoney, KMBC 9 News.
Addiction touches so many families. McCaskill says big drug companies are in fact financing independent pain management groups. Her office releasing a report on that.